Hello, everybody. We want to welcome you to our interview today with Heather Forbes. Heather is a licensed clinical social worker from Colorado, and she is the owner of Beyond Consequences and the Beyond Consequences Institute. Is that correct?
That's correct.
And the co-founder of the nonprofit Codega Foundation, and she's also an author of 4 books which deal with trauma and severe behaviors in children. And this is why I am interviewing Heather today, because many of us, the clients that I work with, Heather, I do emotional release work. Many of them have adopted children or have been through trauma themselves. And I feel like the principles that you teach in these books and in your classes have been so tremendous and so helpful that I want to share with the people that I work with what you've learned and how you have been able to help and support other families. And most of your experience comes from your own adoptions.
It surely does. That's the best way to get the experience.
Yeah. In other words, Heather's not just telling us what she learned from a book. She gets it. She understands. So thank you so much, Heather.
And welcome. It's great to be here. Glad to share my story.
I'm so glad. And speaking of which, I really want to, I know in your books you talk a lot about trauma, but I really want to ask you what it was like for you to not be able to have children and then all of a sudden adopt children and be so excited about it and then come home and find out that your world is falling apart a little bit because it's not what you expected. And I wondered if you could share with us a little bit about what that was like from your personal experience.
Sure. And actually the decision to adopt was actually, it was based off of just medical issues with me, with my back. And so it was just a choice I had made, but it was a choice based off of a history of dealing with a lot of back issues. And I was like, I don't think I want to sign up for the whole pregnancy thing because I had worked so hard to get my body back to a place that I could actually function. It was pretty severe on that level. And so, so we went into the adoption not knowing really anything. It was, I just thought it was a great idea to pack up your bags, go on a plane and find a little child in Russia and bring him back to Florida and everything would be just okay. I was completely naive. No one had prepared me. And this was back 19 and a half years ago, or 19 years ago. And nobody really knew that this was a very traumatic experience, just the adoption itself, much less the early childhood history of my son. Actually, we adopted first. And so it was a complete surprise to me that I would come home and not be able to drive the minivan and go to little play dates like all the other moms and just fit right into the neighborhood. All of a sudden, I found myself really ostracized because my child did not fit the mold of your typical child. And I was at a complete loss of what to do. And I kept seeking professional after professional, book after book after book, because what I was doing, which is what most of us do, just what, the traditional way of parenting, the way that we were parented, our own blueprint, and bringing all that in. And before I knew it, my house was utter chaos. And not just my house and the dynamics, but really personally, I was a complete train wreck, and there's really no other word to describe that's not very clinical, but I will diagnose myself as a train wreck.
I get that. So what were the types of behaviors you were seeing? I mean, just give us a couple of examples.
Oh, from the get-go, he was 2.5 years old, had been in the orphanage since birth, and would not make any contact with me. And he actually connected fairly well with his dad. But then his dad went back to work, so I was the stay-at-home mom, and that's really what I wanted to do, to be this wonderful, loving, connected mom. Well, I couldn't make connection, and not only could I not make connection, he was so aggressive in my house. It was unbelievable to see a child at 2.5, 3 years old that was so violent. I mean, I would stand there in the middle of it, and it was almost like an out-of-body experience because I was like, I can't even comprehend how violent a child this young can be in my own home. And I was there. And so trying to describe that to other people, it kind of looked like then I was just the drama mama, and I was exaggerating all this. And I was like, no, you don't really understand. I mean, I had bloody lips and bruises and pulled hair. I had windows in my home that were smashed to smithereens. I couldn't be in the car without him being completely unsafe. And so it was a very, for me, it was so difficult because I grew up in a very violent household with a dad who was an alcoholic, and I had never dealt with those kinds of issues. I had just moved on, and for for good reason. It didn't bother me. It's okay what it was, and I moved on, and I functioned pretty well. But all that brought back my dormant trauma, my memories of being so scared in my home, and so I was dealing with the old stuff that was piling up and pulling up, and then of course what was in front of me, this child who was complete raging bull, who later on I figured out it wasn't about a child that was mean and destructive. It was a child that deep down within his heart, he was absolutely terrified.
Absolutely. And I have to agree with you. That's interesting that you adopted because of back problems, because that's exactly why we adopted. We had 4 biological girls. We never had a boy. And I had a terrible back injury and tried to recover. And I said, I know we're supposed to have more children, but I don't know how we're going to get them. So we just finally chose to adopt. And
Right.
exactly the same, except our children were adopted at birth. And we had the same thing. He would pick up chairs and 2 and 3 years old and break our tile and break our windows and scratch and throw things at me. And I remember leaving the house one day in the car and saying, I've got to take a break because either I'm going to end my life or someone's going to get hurt in this house.
No, I hear you. That's really the point that our children drive us to. And it's a very dark place to be able to have thoughts like that in your mind. You're like, well, what is really wrong with me? I mean, this kind of stuff doesn't come up in your average household. It doesn't come up in your normal life. And so you're like, what's wrong with me? So no, I hear you. I think that's really what my passion was in working then, once I could figure out what's going on in my home, which I eventually did, but then to move myself into this field, because that passion of giving parents that understanding of when you get to that very dark, lonely place and you are literally in a fetal position, curled up in the bathroom crying, not knowing whether you want to even go on with your life, that we have to bring our professionals in this realm to be able to understand that and support parents, because it's a very, very lonely and dark place to be.
It is a very lonely place, and it's not something you can go to a lunch group with the ladies and say, can I tell you about my day? And they just look at you dumbfounded. They don't get it.
No. I remember going to like a mom's night out, and I'm sitting there completely in awe. Like they're talking about their kids having tantrums, and I'm like, yeah, tantrums. And they're like, 2 or 3 minutes. And I was like, okay, I'm in the wrong group. I'm in the wrong place.
That
talking
is
2 or 3
true.
hours.
It's very lonely. I agree. And I have to ask you, in your book, I want to ask you a little bit. In your book, you speak a lot about trauma and fear, and how there are 2 emotions. Our kids are either acting from a place of fear or love, and in the beginning, it's fear. And I wondered if you could explain that a little more for our listeners.
Well, I think that everything does boil down to something as simple as that, even though we are very, very complex human beings and we have so many different types of feelings of sadness and happy and scared and mad and frustrated. And, I could keep going on for an hour of listing all the different feelings that come up with us. But when you really get down to the root of what is driving those types of feelings and the behaviors, I do believe it comes down to that state of love or that state of fear. And when I work with parents, and this is, my own stories, when things are happening in our homes and we get that feeling of anger, we're just so frustrated, just sit down and say, okay, what's really going on? And if you go layer by layer and unpeel the onion, you will always tempted to say, you know what, I'm really scared. I'm really scared. I'm scared of what to do. I'm scared of what my child's going to do. I'm scared that I'm not being a good parent. And when you can start simplifying a very complex situation that our kids can create in our homes down to something that's simple, it starts giving you something to actually be able to wrap your mind around, wrap your heart around, to be able to actually know how to move forward. So I think that that's one of the biggest things that our profession has failed to do, is to be able to give families something that they can manage. If you go to one psychiatrist and one therapist and one doctor and one OT and the gamut of professionals, it gets so complex that we get overwhelmed and then we don't know what to do. So I really think that that's just a very honest and very truthful way of being able to look at our own situations and then be able to know what to do.
I agree with you. And I've seen this so much in my own children. If we sit back and say, okay, what's driving his behavior? why is he afraid, and what's happening, it just brings us to a place of peace, and we can try to understand, and it has made such a big difference. So I totally agree with you. Um, and I love her books, and I totally recommend them to everybody. But I also have a really kind of an interesting question. I know my husband and I had heard a lot of adoption stories and kind of some scary stories before we adopted. And so we thought, well, we'll avoid all those. We'll adopt at birth, and we're not going to have all those issues. And I remember after attending one of your workshops, you said, well, I have found that some of the most traumatized children are those who are adopted at birth. And I was blown away at that comment because I had thought so differently. And I wondered if you could talk about that a little bit. Why is that?
No, I'd love to share that because I think that story I hear, unfortunately, over and over again. And I'll add to this, just a little diversion before I get into that. But I worked for a private adoption agency, and we did many infant adoptions. And I said to my director one day, I said, well, adoption is trauma. And she was like, well, not infant adoption. I said, oh, yeah, it is. And I about lost my job over that, she didn't understand, and she didn't want to see it as a negative. So why do we need to see it? Not so much a negative, but really what's happening is that when you consider a child at conception, and we're not going to get in the argument of when does a child become a child, but from the body level, from conception to 9 months, you have a child that's in the mother's womb, and that is the very first connection any one of us make is with our mother. And so the primal connection is 9 months in the womb, and that is when the baby's body is developing, and everything about that mother becomes about that child. And so the mother's heart rate, the mother's smell, the mother's voice, that's what's familiar to that child. The auditory processing is online, they say, about 4 weeks after conception. So you consider 8 months of hearing this mother's voice. That's really the voice that the child then resonates with. And even the mother, her emotional self is absolutely transferred. You talk about a mother who maybe was eating, a friend of mine lately would say, oh, when his wife was pregnant with her first daughter, she was a vegetarian. Well, guess what? Now the child's a vegetarian. And with the second child, she was eating meat, and the second daughter's a meat eater. So my point is that everything gets transferred, and that's obviously a very tangible piece, but that also relates to the mother's emotional state. If the mother is depressed, if the mother doesn't want to be pregnant, if it's an unplanned pregnancy, which is sort of the politically correct term, but really it's an unwanted pregnancy from the child's standpoint, because the child comes into this world feeling that he's not wanted, right? Or she's not wanted. And so that emotional state of the mother absolutely gets woven into the fabric of that child. So then that child is born, and that mother has made plans to place that baby into the parents, like yourselves and your husband, into a loving family. And so it's not a criticism on the family that the child's going to, but from the child's perspective is what we always have to look at. And when the child then goes from a womb and a mother that he is familiar with into a mother and parents that he is not, what is that? It's trauma. There's no transition. There's no acknowledgement. From the adult perspective, it's a beautiful thing, and it is. And I'm an advocate for adoption. But from the child's perspective, they've lost absolutely everything. Even though it might be the best thing in the long term for that child, but in that moment, everything is different. And so that child doesn't know what to do with that. So I really do work with parents to understand that even just the process of adoption to that child is a traumatic experience. Again, I'm not being negative. I'm just saying what is truthful about this child. And then what we also have to see is, again, if that child has been in a womb of a mother who has been under domestic violence, stress, financial stress, gotten kicked out of her home because she was pregnant, all these dynamics, again, all of that plays into the factor of what that child's perspective of the world is, what their belief system is. Their brains are very underdeveloped, but there's still a part of their psyche that is absolutely present.
Absolutely. And since that time that you told me that experience, I've really been studying womb trauma. And when I got into the work that I do now, emotional release work, we use muscle response testing to see what kind of energies are being found in some of these kids. And I'll never forget this little boy that came in, and we were testing for terror. and horror and abandonment and betrayal and rejection. And this was all first trimester and second trimester in the womb. And I turned to the mother and I said, do you have any idea what went on during that pregnancy? And she did some digging. And the adoption agency said yes. When the boyfriend found out the girl was pregnant, he beat her. He told her to get an abortion. He constantly yelled at her. It was a very terrifying experience for her, a very, very emotional time for her. And what she said was so interesting was she noticed when this baby was placed in their home that anytime a man would walk in the room, he would cry and hang on to the mother. And he was, till the time he was 8, 10 years old, he wanted to hang on to the mother. He was scared of men. And when we started doing this emotional release work, in fact, it brings tears to my eyes because it was a really tender moment for us to really realize how much trauma this little baby had really gone through. And it's someone very close to me, and that's why I'm a little emotional talking about it. In fact, I guess I will just come out and say it. It's my son. I didn't want to divulge it. But it was. And when I understood the trauma and the horror and the pain he felt, we and my husband, we could both love him from a different place. And we could be patient and we could be gentle. And as we worked to release these energies, our relationships really healed. And it was really a neat experience. So I feel like that's true. So.
That's an awesome story. And, it's unfortunate. I think a lot of kids don't get that release. And so the parents don't understand. And it's hard not to take it personally. I'm sure your husband, the minute he walked in this room, the son's rejecting him. How do you just sort of overlook that? It's a baby or a little boy, So it's hard for us as parents to be able to get past that. And so I think it is that understanding when you can really get into the shoes of that child to see it from their perspective, that all of a sudden your resistance and your, that wall that we end up putting up in front of us to protect ourselves can kind of crumble. And that's when the relationship can really be able to build and enhance. So I'm just so happy that you were able to do that.
Yeah. And you're right. My husband did say that. He said, we spent all this money. We had 4 girls, biological, and then we adopted 2 boys. And he said, I've waited all my life for a boy just to reject me. I mean, he was so depressed for the longest time. And he just said, and it can be hard on a marriage. And
Yes.
We really had to work through some issues because all of a sudden it was your idea. And then, we kind of had to really work through that. And once he understood the trauma, when he saw us pull out that trauma and that terror and that rejection, he just loved my son. And it was so healing for both of us. So, yeah, it's true. In your... you also... I lost my train of thought for a second. Oh, yes. Okay. So sometimes, which kind of leads me to this question I think all of us have to face at some time when these behaviors start disrupting our home and the flow and the peace, well, as peaceful that a home can be, parents sometimes start to think, well, maybe we should give him back. This isn't working for us. And it is very traumatizing to a child to have that experience. And I wondered if you could explain a little bit about that.
I guess best I can explain is, where does that come from? And I would never agree with it, because once you are a parent, I believe you're a parent forever, and there's always a way. But what drives us to that point that, like you said, you go through this amazing experience with adoption. It's if you've done a private adoption, it's financially humongous. If you've done, adoptions that are within the system, still you allow people into your home, and it's a very, very conscious decision. How do you go from this place of being very, very conscious of this to all of a sudden saying, get this kid out of my house? I mean, what are the steps along the way? It's not like you go, oops, I adopted, like some mistake was made. It is such a conscious experience and decision, the commitment, everything. And then 6 months later say, I can't do this. So I believe that what it does is it opens up a very sensitive place in us as parents. And I think as human beings, there are two fears. Again, getting back down to that primal sense of fear, there are two fears that all of us have to find our way through. And that is the fear of not being lovable and the fear of not being good enough. And if there's been ever a situation, I think, in any human's life, it's the adopting or the parenting of a child with trauma that will bring this to its forefront. And when you can't feel effective as a parent, when you can't feel like you can even love this child, like your husband's great example, he can't even walk in the room and even soothe this child and so even though we're grown adults, we've had these jobs that we've said we're successful, every plaque on our wall, all of a sudden we are brought down to our knees, back to the very basics of the fears within inside of us. And so whether or not we can face that, we know how to face it, we ultimately look for an escape. And we get down to our own place of survival. It's just going down to that deep, dark place of survival. And I don't ever judge a parent that says, get this kid out of my house, because what I know is that parent is in a place of, I don't think I can make it anymore. Yeah. And so it's just working with that dynamic and supporting that parent through it and being able to say, okay, well, this is what this child has brought to you. And this is very hard because it's really, when we flip the interpretation of all this around, it's really the gift that the child has brought to you. And I know if there's a parent listening to this that is in that dark survival place, you're like, really, I'm going to turn this off now. Don't turn it off. But it's to say, what is it that this child needs me to see? What is it from a divine standpoint? I think this is a spiritual experience. So what is it on this planet that I am here for that I have to start looking at? Because this child is making me look at that now. And whether we embrace that or not is really going to be then up to us to take that responsibility. So I hope that answers the question in front of me.
Well, it's something, unless we were in that deep, dark place of fear, that's not even a thought that we would even consider, but because we are so traumatized ourselves as parents, those are thoughts that, in fact, I remember talking to my family, my extended family, about our situation, and they'd say, well, you need to give him back. Well, it's going to ruin your home. And I just would go away crying. That's not what I wanted to hear. And so when I would come to your lectures or take your online class or read your book, I'd say, finally, somebody knows how I feel. And it's worth it. And we can make this step. In fact, I remember telling my husband, I said, honey, I will not live my life in regret. If I take him to somebody else, who will love him as much as I love him? Because I do love him as if he were come out of my womb. It's the same for me. I'm in a terrible place. But I love him enough to find a way, And that's what you did with your children.
Absolutely. And I think anyone can do that, even if it feels like I can't even get up out of bed the next morning. We have to never lose that faith. And that's why my sort of tagline is that love never fails. We think that love has failed us. I think what has failed us is as much fear and misunderstanding that we go into this with. That's what has really failed us. And when we can get to the truth of what is really going on, the depth of the root of the issue, like you just gave example of your son, perfect example. If you had never known that depth of fear and terror within him, it still would have been very difficult to continue loving him, even though you're a loving person and you have a loving home. But when you don't understand, that's when things go awry.
Absolutely. And that's why I really was attracted to get into this work that I'm in now, because it really helped me understand my children. In fact, one thing I do is called heart. We try to break down the heart wall around these kids who have attachment disorders. And I'll never forget my oldest son, who's 14 now, when I learned how to release energies around his heart. There was all kinds of abandonment issues, but the one thing that kept coming up was fear. And I'd say, Trevor, do you have are you afraid of your teacher at school? Are you afraid of, what are you afraid of? And he just shrugged his shoulders. I don't know, Mom. And so I start these questions. And finally I said, it just came to me in my mind, are you afraid we're going to send you back? And he said, yes. He started crying. And I just hugged him and I said, no, we are in this for the long haul. We love you. We're not sending you anywhere. And then I released this fear with this energy technique, and immediately I felt this connection to him, this restlessness that he'd had for so many years stopped immediately. And I didn't see it ever again. And it was the most beautiful moment for us as a family. So
yeah, and he was in your home for 14 years, and he still had this fear.
he still had it.
No, my son at 16 came up to me one day and said, "Mom, some days I just don't know you're not going to send me back." Aww. After I had been parenting all like this all along. And I think that, besides the energy work, I also think that giving kids a voice to that, allowing them to say that when they can just get it out and be heard and be understood, that's what I think a lot of our parents can also do, just within their own homes, without the professional help, to start the process and to be able to acknowledge that and not to minimize it, to go, no, honey, that's silly.
Yeah.
Say, I had no idea. You've been carrying this load around for 14 years. Yeah. I'm so sorry I didn't know. Yes. And to be able to connect with our kids at that really heart-centered place so they can continue to open up that heart to us of what their fears are.
Yes. And it's interesting, just one little quick story. When I took my second son to kindergarten, he just would always cry. And when I would take him and I just talked to his teacher and I'd reassure him, look how nice your teacher is and look how much everybody loves you. They all say, hi, Caleb, when you go to kindergarten. And yet every time I would take him, he would cry. And finally, after a month of these meltdowns and everybody saying, oh, he just has separation anxiety, I finally turned to him in the car. And I stopped worrying about whether I was going to be on time. I just sat in the car with him and I said, Caleb, why are you so afraid? Yeah. And I just sat there and looked at him. I wasn't trying to rush him. And he said, Mom, I feel like when you take me to school, it's like you're leaving me like my birth mom left me. Mm-hmm. And he just started to cry. And it was I just grabbed him and I hugged him and I said, I am so sorry. I had no idea you were feeling this way. So I said, you know what I'm going to do today, Caleb? We're going to go in and I'm going to stay with you all during school. And the teacher was awesome. She had adopted kids herself, so she totally got it. I stayed with him the whole time and we had a beautiful experience. And so I really agree with you. These are all so very, very important. And you offer so much support to families, Heather. And I just want to let people know about all your classes. I love your newsletters. And I'm really enjoying your daily reflections. Every day I'll wake up with something I'm mad about something about one of my kids. And all of a sudden there's an email that says, remember your child might be going through this. And I'm thinking, oh yeah.
We live this stuff day in and day out, and we become very human again, and that whole dialogue of what to do is gone, and all we do is get frustrated. So that's where I did come up with the Daily Reflections. It's a free service. I just have it hooked up to a big mail server that we have, and you can go on my website and sign up for it, and just look for 100 Daily Reflections. And in your email box every day for the next 100 days, you'll get just a little parenting nugget to sort of set your tone for the day. And I think it's a good way for 3 months basically of having someone else's little thought in your head so you don't go back to your own thoughts, because that's what we have to start clearing out. So yeah, the Daily Reflections, I have a lot of stuff that I try to do to support parents at no charge, like reflections, a lot of stuff on my website. There's an Ask the Expert series where I've done basically what you're doing here. I've actually interviewed other people in this field that had specialties like sensory processing disorder or learning about kids and video games. And so parents can go and sign up and just put your name and your email, and then you can be able to listen to all these interviews absolutely free. I do have also online classes. Actually, one's coming up next Tuesday, April 7th, on working with kids in the classroom. So we're taking all this parenting ideas and the understanding and applying it then into the classroom, because basically what a teacher becomes is that parent, the sort of a pseudo parent for that next 6 hours, because that child isn't able to stay on their own and regulate. They do need that adult. And how do you create that within the classroom, even with a class of 30 kids who all might be pretty traumatized? So we'll be starting that. Parenting classes, I have some on-demand classes, meaning you can sign up right now and you will have access to 10 sessions of my parenting class. That one's pre-recorded. That way, no matter what your schedule is, 24 hours a day, and if you can't sleep at 1 a.m., you can at least get up and start finding out what to do when you do have to roll out of bed at 6 a.m. So anyway, books are available. I don't know. I just keep developing more and more resources because it's important to continually feed ourselves with information. So I just want to encourage parents to go to my website, beyondconsequences.com. find what's available, what works for you. Some of it will be visual, some of it's auditory, some of it's reading. So find what works, but never leave yourself with nothing. Always support yourself. Always get yourself resourced. Whether it's my information, there's some other colleagues of mine in this field that are very good as well. Just make sure you're always resourced, and so you're not alone in this. That's probably the one dynamic we have to avoid is becoming very isolated and feeling like we're not supported at all. And that's a hard thing to overcome.
Yes, it is. And I really agree, Heather. And I thank you so much for being with us today. And everybody, if you do one thing, whether you have adopted children or not, it works for teenagers. It works for anybody that's gone through their own family issues or their kids' issues. The principles are sound. And I personally want to thank you for your work and all that you do for all of us. So thank you so much for being with us. And I'll go ahead and sign off.
All right. Well, thank you very much for having me on, Jan. Good luck with all the work you're doing as well. And your
Thank you so much.
Okay. All right. Take care.
Bye-bye.